biochemist, a research scientist, and an internationally known speaker on the subject of hormone imbalances, natural hormone replacement, saliva hormone testing, and breast cancer. He is the founder and laboratory director of ZRT Laboratory, located in Beaverton, Oregon, using saliva for testing hormonal levels since 1998. After receiving his PhD in biochemistry from the University of Tennessee in Memphis in 1974, he pursued his interest in cancer research. Working in the US and Switzerland, he focused on hormonal control of breast cancer. Dr. Zava developed saliva testing as a simple, non invasive means to test hormones and as a means to evaluate hormonal risk factors for breast cancer. Because steroid hormones play such a vital role in maintenance of health, knowledge of an imbalance in any one or more hormones can help to eliminate the cause of health problems and provide a basis for correcting the imbalance through diet, exercise, or hormone supplementation. Dr. Zava has co authored 60 scientific publications and is the co author with Dr. John Lee of What Your Doctor May Not Tell You About Breast Cancer and How Hormone Balance May Save Your Life, published in 2002. Dr. Zava, are you there?
I'm here, Dr. Taylor. Thanks for inviting me.
Okay, so great to have you and so great to hear from you. Uh, some of the people on here may have heard you in the past. Some of these are guys who have been around, but a lot of these are new people, and they may not understand what a pioneer you are in specialty testing, especially saliva testing, and you've been at this for quite a while. I started speaking pretty much in 2002, and you are I am saying that the people I invited to this conference are the people who taught me, and you are definitely one of the people who taught me a lot as I was listening to you as we shared a lot of stages together. So I won't talk anymore. I'll let you kind of talk about what you're planning on speaking about when you come in March. So, Dr. Zava, the floor is all yours.
Oh, thank you. Um, and thanks for those nice words and compliments. What I'm going to talk about in the meeting in March is about testing hormones. I mean, almost all physicians are at some point in time testing hormones in patients who have apparent hormonal imbalances. So, my field of expertise, I've been around a long time, and my field of expertise is in development of hormone tests. And I'm going to talk about what's known in the literature about the pros and cons of testing hormones in different body fluids, from saliva to conventional venipuncture serum, compare it to capillary blood, or what's commonly known as dried blood spot testing, as well as more recent tests that we've developed for looking at hormone metabolites in urine. So pretty much cover the spectrum of all of the types of body fluids that are used for testing. And in addition to that, I'm going to talk about the pros and cons of different kinds of tests that are used. Primarily, the two different types are either going to be an immunoassay, we commonly know them as enzyme immunoassays, as well as mass spectrometry using LC or GC mass specs. And we're doing all of those kinds of tests in the laboratory. So we have a good opportunity to compare and contrast how these kinds of tests are working in the laboratory setting, in relationship also to how a patient is doing, because we want to be able to develop the best test that's going to give you the best clinical picture for your patient. And I'm also going to explain why some tests, some body fluids, and some tests are better than others. For example, if you use topical hormones, the hormones really don't show up very much in serum, and we know now from more recent testing that they also don't show up in urine. and that's pretty much true across the board for all steroid hormones that are delivered topically. If you measure them in venipuncture serum, you really don't see much increase, and that depends on the hormone also. And it also doesn't show up in urine, but it does show up in saliva, and it does show up in capillary blood. Research studies have shown that the hormone shows up in tissue, and then there's a biological response. So we're going to talk about those issues and give you some idea about why there is a difference in the fluid levels of these hormones based on the type of delivery that is used. And the biggest paradox, the biggest conundrum, the most confusion comes with topical hormone delivery. So I'm going to focus a lot on that. We've recently published a paper in Menopause on topical progesterone delivery. That was published in the November issue of Menopause. There's another article coming out in several other journals related to topical delivery and why hormones are showing up in some body fluids and not others. And so those are the things that I'm going to be discussing during my lecture.
You know, Dr. Zava, I think, I always say that a lot of times docs are skeptical. These are conventional docs, skeptical about looking for things in places that they're not used to. They're used to drawing blood. They're not used to collecting saliva. They're not used to doing urine tests. And I really think that it's important. And you explain it well, and I do the best I can is that you have to look for what you're looking for where it is and not where you are comfortable looking. So I think it's very important that you're doing all of these different tests, and you can instruct us where do you look based on uh, how you're delivering it and what are you looking for. And you do have to have a kind of basic understanding, and when you do, it makes a lot of sense.
Right, and all of the tests work. I'm not
Yeah.
I'm not here to say, oh, that one test works better than another. I mean, I
Right.
started with saliva testing. We went
Yeah.
from that to dried blood spot and compared that to serum and then to urine. So
Hmm.
they all work,
Right.
and they all work well, and sometimes they don't work as well, and that's part of what I'm going to talk about. In
Yeah.
particular, with topical delivery, it's more problematic looking at some body fluids. I'm going to show results of that and have published that, as I said, in the journal Menopause.
Yeah.
Marcharitas asked us to write a commentary about the work that we did and we published in Menopause. So that's coming out very soon, if not already.
Now,
Um,
isn't menopause, isn't it published by the North American Menopause Society?
yeah, that's right. I can't believe they actually published
Uh,
it.
I'm going to have to stop dogging the North American Menopause Society out because Dr. Zav, when we first started, I never would have guessed in a million years that you would have gotten an article published in menopause. So,
Right. I wouldn't have either. But it was a real coup for us because
mhm,
it compares saliva to serum to capillary blood. I think it was because we were also looking at blood,
yeah,
but it really gave us a great forum for discussing the differences in
yeah.
those body fluids. And so those of you who want to take a look at that paper, it'd be a good paper to look at
Can,
because it's a lot of what I'm going to be talking about.
well, that's great. Can you send that to me, and I'll just
Sure.
send it out because that is absolutely amazing. I mean, I'm telling you, it uh, it blows me away. When you said that, my mouth dropped. I was like, "That's the North American Menopause Society."
Right.
So but science is science, and I've always admired you because you are a true scientist. And I've always given the North American Menopause Society a hard time because I don't think that they really followed science. They really wanted to perpetuate the status quo. So I'm going to give them a little bit of a break and praise them to say they actually let a scientific article and commentary be published. So
Yeah,
uh,
I think they're getting better, but you know as well as I do that I remember when you provide your levels of evidence
right,
in your lectures. When they talk about saliva testing, their levels of evidence are basically layered reviews of reviews that
yeah,
actually don't have any science behind them.
exactly. I know.
Um, and so that's most problematic. So this was good. As I said,
Mhm.
it gave us a good forum, at least to publish something in there about saliva testing.
Right. Well, if
So
you send me that article, I will put a link. I will link it somehow. I'll give it to Pete and link it somehow, and we'll send it out on LinkedIn and to let people know uh, about the article and let them know that this is going to be a part of your presentation. So congratulations. I'm very proud and like I said, I'm a little bit shocked, but again, science is science, and I'm glad that they're finally promoting science and not and not their opinion. So okay, well, Dr. Zava, again, it's great to talk with you. I'm excited about you coming. You've always wined and dined me when I've come out, so we're going to wine and dine you
no,
when you
great.
come to Atlanta and show you the best of Atlanta. So again, Dr. Zava is a good friend of mine. I consider him a friend. And he's a great scientist and a great person and a great author and a bunch of other stuff that I won't mention right now. Good stuff. and and so thanks again, Dr. Zava, and we'll talk to you soon. And please send me the article in menopause and the other article that you're talking about. And
Okay,
yeah, and we'll get it out for you. Okay.
great. Thank you so
Okay.
much. Talk
All
to
right.
you later.
Great. Thanks a lot. Thanks a lot. All right.
All right, take care.